Good afternoon, and thanks for joining us. I'm Dr. Martha Buchanan, Public Health Officer and Senior Director for the Knox County Health Department. Our moment of gratitude today is dedicated to our KCHD team and county colleagues who are working our COVID-19 drive-through testing event today. Volume today has exceeded our expectations, already more than quadrupling what we typically saw in a day. While we are thrilled with that response, we do not have unlimited supplies. So we may have to make some tweaks to our schedule going forward in the week. We are continuously working to get supplies to be able to do more testing. But in the meantime, we appreciate your patience as we work to test as many people as we possibly can. And I also want to remind you that testing is available at several other locations outside the health department and outside our drive-through at medical offices and urgent cares and other places. So you can seek out those resources as well. And while we are testing anyone who is concerned about their health, we really want to focus on those most at risk of having COVID-19. So what that means is we're really focusing on folks who have symptoms of COVID-19 or are close contact to a confirmed case of COVID-19. So just as a reminder, we talked a little bit last week that we expanded our symptom definitions to include fever, cough, shortness of breath, but also chills, sore throat, headache, and loss of taste or smell that's new. Regarding the cost of testing, for those providers who are testing out there and for those who have insurance, most insurances are covering COVID-19 testing at 100%. So what that means is there shouldn't be no cost to the patient for the cost of that test. If you do not have insurance, you can give us a call or you can come to our drive-through as we keep you updated on the details of when we'll be having that. We really are encouraged with the success of testing across our state, because we know through testing, we'll be able to see as a state really what the burden of COVID-19 disease is in our community, not just in Knox County, but across the state. And that's one tool we have to help us see how things are going and who's ill and where we might need to intervene as public health and isolate folks or do more contact tracing. So the other thing about more testing is that it's going to increase the number of positives that we see. We know that some of those folks who got tested are going to be positive, so we expect to see some increase in positives across our state and in Knox County. In addition to that, we also expect that there'll be some delays in testing results. So the lab's got a big volume of tests over the weekend, and so it's going to take them a little longer to run all those tests. So it's going to take a little longer to get those tests back. So again, we ask for people's patience in that. As a reminder, if you do get tested anywhere, with your doctor's office, with us, you need to self-isolate until at least for 14 days, or until your test results come back, until your test results come back. So what that means is staying home. You're not going to work, you're not going places, you're staying home and waiting for those test results to get back, and even staying away from your family as much as possible so you don't put anyone at risk. We've actually gotten some questions about what kind of test are we using. Whether it's a rapid test that can, like you do with the flu, that you can get results right away from. There are no rapid tests right now for COVID-19. We are using what's called a polymerase chain reaction test, and that's a test that detects the protein of the virus in the sample. So take a swab from your nose, send it off to a lab, and the lab runs the test and detects the virus protein in that sample, and that tells us that you have the virus. There are also some questions about antibody testing. Antibody testing is out there, but still is only to be used for experimental purposes. It is not to be used for patient care. It's not to be used for diagnostics. Those tests have not quite been validated, so we don't know how much we can trust those results. So they're not useful to make decisions about what to do with the patient. So understand that those tests are not useful at this time. Lots of people are working so that we can have those tests because they will be speedier and help us be able to provide better guidance when they're reliable and we can use them for that. So we're hopeful for that. We're just not sure when that's going to happen yet. So now turning to our local situation, we have 193 cases of COVID-19 in Knox County. 161 of those have recovered. 27 individuals have been hospitalized at some point in their illness. And we are grateful to say that we have no additional deaths to report due to complications from COVID-19. So now I'll open it up to questions.
All right, if you have any questions, please go ahead and submit them now. From WBIR, you said testing volume had quadrupled expectations. What are the specific numbers so far? And what's your daily capacity to test? And what happens to those in line when supplies run out? I can ask those in a series if you prefer.
Sure. Actually,
Say that question more.
They said, what are the specific numbers so far?
Oh, it is. Hold on a second. Go to.
okay. So what we do is when we have a line of cars out there, our staff estimates about how many more they can do. And then they count back and tell the people behind there that they can maybe come back tomorrow. We'll be able to do 400 tests today. We anticipate being able to do 400 tests tomorrow, and we'll have to see about the rest of the week. Did I get them all?
Yes, that's it. Cole, if you had any additional questions, please submit them. From WUOT, about the currently used PCR swab tests, they don't give an indication of how far along someone's case is, do they?
They don't. They just help detect the presence or absence of the virus, and they actually don't even tell us if the virus is live or not. So people can sometimes test positive after they've recovered and they're no longer infectious because there's some residual not living virus in their system.
From WBIR, we saw protests at Westtown Mall this weekend from people demanding that stay-at-home orders be lifted. What would you say to these protesters?
I think everybody's ready for us to be able to open up our economy. We support opening our economy when we can safely do that. And we're looking toward being able to do that in the near future. I understand people's frustration. It's frustrating for all of us. And we will work with our community leaders to make a safe decision about when we can open our economy back up.
Any other questions? Please go ahead and submit them. From WBIR, if someone had COVID, quarantined properly, and no longer has symptoms, is it safe to be around them?
It is. After somebody's had COVID and they're no longer symptomatic and they've been that full 7 days or 72 hours without symptoms, it's safe to be around them. They can return to work. They can return to normal activity.
From WBIR, we understand golf courses have been busy during the stay-at-home order. We've received a number of emails and calls with concerns about this. Are you concerned that closing so many businesses has led to crowding at the ones which remain open?
I wasn't aware golf courses had been busy. The same rules apply on the golf course. You need to make sure you're 6 feet apart. So maintain social distancing and with the people that you're golfing with. And that goes for playgrounds and other places. We want you to wash your hands, observe social distancing, don't go golfing or play to the playground if you're sick. Those are all good rules of thumb no matter where you are.
From WUOT, as testing broadens, do we have a better impression now about the percentage/proportion of asymptomatic cases?
Well, we just started broadening our testing. So we'll have to wait and see. And like I said previously, it's going to take a little bit of time to get those test results back. Our test delay had been anywhere from 4 to 5 days. We expect that might get a little bit longer, unfortunately, just because of the volume of tests going to the labs that are doing the testing.
From WVLT, with the increased testing on anyone who wants to be tested, is there a longer delay in getting results?
I think I just answered that.
Then the follow-up was, there will be individuals waiting for results who are positive. Are they in greater danger because of delayed treatment?
Well, there's no treatment for COVID-19. The treatment for COVID-19 is symptomatic, rest, fluids, ibuprofen, Tylenol, those things. If you get really ill, obviously you have to seek medical care. If you have been tested and you become ill enough that you need to seek medical care, you want to call ahead and say that you're worried you might have COVID-19 so they can be prepared to receive you when you get there. So the delay doesn't cause any delay in treatment because there is no treatment.
From the Sentinel, last week you spoke about a lack of testing in East Knoxville. Can you give us an update on that?
So we're working actively to locate a place that we can have a testing site in East Knoxville. And so we're working on those details. It takes time to get the right place and get all the agreements in place so we can do those things.
From WBIR, we're beginning to see reports from New York that some with serious COVID complications require long-term dialysis treatment. Is this a new concern with coronavirus patients?
I know that anybody who becomes chronically ill can end up having kidney damage. And I also am aware that there's some bleeding disorders that can happen with COVID-19. So anybody who's critically ill and ends up in the ICU or has to be hospitalized can have kidney damage. So it's something that happens. I don't believe that's new in just specific with COVID-19.
From the Compass, can you speak to the way testing works in tandem with contact tracing to help address COVID?
Sure. So when we test somebody and they test positive, we isolate that person.
And they should have been isolation before that.
Right,
by the way.
they were in isolation previously. We make sure they stay in isolation. And then we ask them about their close contacts, who lives in their household. We talk to their household members, educate them about what to watch for and to call us immediately if they get sick so that we can test them as well. We also go out beyond that a little bit and ask them about their close contacts, people they spend time with, people they maybe were within less than 6 feet of each other for more than 10 minutes. And we actually reach out to those folks as well and educate them about what to watch for. Moving forward, we hope that we'll be able to test those people after a length of time, when 5 to 7 days after their exposure, so that we can catch those cases early and isolate them as well.
Any other questions? Please go ahead and submit them now. Okay, if there are no further questions, we appreciate you all joining us, and we will see you Wednesday at 12:30. Thank you.